Since I was small, I was interested in medication. So if I see a pill bottle at home, I look at the bottle, I be reading it, looking at the pills that are inside, crushing the pills at the school. I was really interested in how they work. How do you know where the pain is? Like how the pill knows where the pain is. So I think I used to think to myself, and that's so what is most important at that specific time. So it's not all the time that one thing will be most important. So you have to prioritize. So I like to write. I'm very structured in that way. So I write down exactly what I need to do for the day or what I have coming up for the week. And based on that, I can schedule out my time. But I always ensure to make time for myself. So currently, I am really interested in oncology, and I am doing some research to see how much of a role a pharmacist can play in the field of oncology. So I've been looking overseas, to see there are the programs where you can, get more acquainted with treating oncology, treatment of patients in oncology. Because that's what I'm really interested in. I used to think that I wasn't good in math, so even this is much for me. But a lot of calculations. However, just have to practice. Once you're in pharmacy school, you realize you just have to practice and practice and practice. Practice makes perfect. Don't be deterred, just try your best. Do your best in your C6 and your capes because they want the good grades. That's what they're looking for. So you might not be at the top of the list if you don't do very well. So I'd say do well in school, focus, and when you reach to university, ensure that you keep that focus because it's not going to be easy.
In Office with Dr. Jevon Samuels.
Welcome to another episode of In Office. I am Dr. Jevon Samuels. Today in office with me is a brilliant pharmacy student, Oshaunae Williams. Welcome to In Office. All right. So today we'll be discussing life of a pharmacy student, and she's a final year pharmacy student who will use as an example of what a pharmacy student is like. Life is like. So a pharmacy student is normally an individual who was pursuing a university degree in pharmacy at a recognized university or college. They normally undergo rigorous training in both academic and clinical areas, and they will normally do studies and research in different areas such as pharmacology and also therapeutics and actually pharmacy and pharmacy management. They also would tend to undergo communication and interpersonal skills and also undergo clinical skills. Now, all this training normally would ensure that they are ready for a career in pharmacy. Some choose a career path as a retail pharmacist or community pharmacist. Some will do hospital pharmacists or become research or clinical pharmacists, as well as some may choose to continue research in the industries, and some actually do a career in the clinical areas such as public health. Now, without any lengthy introduction, I want to discuss the life of a pharmacy student, and I hope for students that have interest in becoming a pharmacist will benefit from this podcast today. All right, so once more, Ms. Williams, welcome.
Thank you.
Welcome to In Office. All right. Now, tell us what are some of the subjects that are required for to matriculate in pharmacy school.
Alright, so when you're interested in coming to pharmacy school, some subjects that you'll have to take will include all the sciences, so chemistry, biology. You can do physics if you do choose, but you'll have to do it anyways once you reach to the university. However, chemistry and biology is a must. And, you must have your mathematics and your English. And those are 4 subjects, right? Mathematics, English, chemistry, biology, and one other subject, which physics is a good option. So, person to add mathematics, various subjects you can choose from. However, physics is a really good choice.
Okay. So in terms of the different, in the Caribbean, we have a CSEC level and we have CAPE level. So you tell me about these 4 subjects, CSEC levels.
Right.
So do you need CAPE subjects too?
Definitely. So you'll have to do CAPE unit 1 and 2. And you'll have to still do that chemistry and the biology once more. And you get to choose what other CAPE subject you'd like to add to that.
Okay, all right. So let's confirm. So you need compulsory biology, chemistry,
Right.
mathematics, and English,
Right.
plus a third. So
A third
a fifth subject,
subject.
which doesn't necessarily have to be physics, but physics is a good option. And at CAPE level, you need biology and
Biology and
chemistry.
chemistry.
Both units, all right. Now, What had inspired you to choose a career in pharmacy?
Right, so ever since I was small, I was interested in medication. So if I see a pill bottle at home, I look at the bottle, I be reading it, looking at the pills that are inside, crushing the pills at the school. I was really interested in how they work. How do you know where the pain is? Like how the pill knows where the pain is. So I think I used to think to myself. And as I got older, I started to get more interested in research and all those things. And just reading more into what pharmacists really do as a profession, I started to become interested in pharmacy as a whole. And so I grew a passion for learning more about drugs, and then yeah, I decided I had to apply to the pharmacy.
Okay. Yes. So, what back to the topic, the area about the subjects that you do. What are the subjects that you find interested in pharmacy school, and what are the areas that you like?
Okay, so in pharmacy school, the subjects that I really pull to the most are those that are more so practical. So, for example, we would be doing pharmaceutics labs, and we have to compound in those labs. So we make creams, ointments, we make suspensions, so we can change a tablet to a syrup form for a child. All of those things that we learn, those are probably my favorite subjects to do in pharmacy school. In addition to that, I also enjoy doing those subjects where we get to learn more about different diseases. So clinical pharmacy and therapeutics, those type of modules, subjects, those are the ones that I draw to the most.
Okay, well said. So now, like the concept about like converting medication from the tablet form to the liquid form for kids. Now, we mentioned about this chemistry and the biology earlier. So that's where the chemistry would come in. Like you have to do certain calculations to
Yes,
study those.
You definitely have to do some calculations. You have to know how these drugs work in children versus an adult. And we learn all these things, and there are guidelines that help you as well, so you know what to follow to properly those children and how to convert those things. So we do learn how to calculate. So chemistry is very important. That's why you have to be good at your maths as well, because you do a lot of calculation in pharmacy school.
Okay, all right. So it's not an area where you can have weak background in the sciences and maths. You have to have strong.
You have to be strong.
All right, right. Now, how do you manage to stay current with the latest literature for pharmacy? 'Cause I know that I'm in medicine. We tend to have literature change on a regular basis. New drugs come in often. How do you manage to stay current with these new developments?
Right, so we are required to read the guidelines. So as soon as there's a new guideline, we have to keep up to date with them and read them. So, for example, the ADA guidelines that is improved each time for diabetes, we have to ensure that we're up to date with those, because we cannot come in a setting where it's ever changing and we are behind. So we have to keep reading. So we have to find those guidelines on the internet. You have to download them, read them up, no matter how long they are. We have to read them and be acquainted with them so that we can properly assist in the healthcare environment.
All right. So last week, actually, we met last week. We had our first discussion last week, and I was asking you what you guys are doing on the ward, and you said that you're doing externship, and I was curious. So you want to explain to the viewers what we mean by externship, because I was new to that concept myself.
Okay, so if you look for the book definition of externship, it would be that you're just shadowing the professional that is in that field. So you're not doing exactly what they would do, but you're shadowing them per se to see what they're doing, so you can learn from that. And in internship, you will be doing what they do, but being supervised. So to put that into our actual setting now, when we come on the wards, we actually follow patients each day. We're supposed to follow a minimum number of patients for the week, and we're to review how they're being treated and see if it actually matches guidelines and the way that they're supposed to be treated. So, optimal care. So we should be, making recommendations, or if we believe that something can be optimized, we have the opportunity to say it to a medical doctor or anyone else that is on the healthcare team.
Is there any particular experience in the externship program thus far that you'd like to share? Just an experience.
Well, I'd say there was once when I was at a particular hospital for my hospital externship, where I would have realized that a patient was taking duplicate therapy then. So he was taking two things that are doing the same exact thing for a specific cancer that he had. And I would have highlighted that to my preceptor, and it helped to optimize his therapy. So it gave a sense of fulfillment that you could have helped to optimize somebody's therapy to make their lives better, reduce the side effects that they might have been having because of taking the same things. Some people the same things.
Okay. I know that a part of a pharmacist's clinical experience is to educate and counsel patients and their disease plus the medication. So, what is your approach in education and counseling patients and in general?
And so before I approach a patient, I have to first analyze that patient. So, you look at their prescription and see what they're getting. You have to figure out what are they being treated for because it's not always there listed out for you. So you have to see. This medication might be for several things, but this patient is being treated for hypertension. So now when you see this, you can have in mind not only just generally telling them about the drugs, but telling them how they can improve their lifestyles. So, if you can tell them, you need to exercise more or eat less salt, stuff like that. So you analyze that patient, know what they're being treated for, so you can give them the best counseling. When you approach them, you can approach them like a robot, as if you're speaking to machines, where you're treating them like a human being with emotions and feelings. So sometimes they might be angry, sometimes they're upset because they're waiting in a line. We have to empathize with them and still be able to counsel them even through them arguing. So there are lots of communication, like I said before, that we have to learn in pharmacy schools. We're able to deal with persons in the best possible way.
Okay. All right. Is there any research project or studies that you are currently involved in? And if yes, would you like to share some of the experience with us if you don't mind?
Okay, so currently, we have to complete our major project before graduating from university. And my major project is centered around not something clinical, but it's more so around the training of pharmacy students. So it's around the use of AI in pharmacy learning.
Okay.
And so we are interested in finding out how can we improve the study of pharmacy using AI. And it's especially important because, the world is advancing.
Yeah.
So AI might become a part of pharmacy practice very soon. So we need to be trained to work with AI to supplement what we are doing so we can still offer good care to patients.
Okay. All right, my next question is what are your thoughts on some of the current pharmacy issues that we have, such as hesitancy to vaccine or opioid overuse or addiction?
So some of the opioid overuse is not so popular in Jamaica as it is in some other countries. But vaccine hesitancy, we know that's popular almost everywhere. We consider with COVID vaccine as well. But it's important, that's why patient counseling comes in again. It's important to let persons know exactly why it is important to do certain things. Even with antibiotics as well, some patients they choose when to take the antibiotics, choose when to stop. But it's our jobs as pharmacists, upcoming pharmacy students to know how to let patients be aware of the importance of these things. So let them know that if you stop taking antibiotics, this is what's going to happen. If you don't take the vaccines that you need to take, you're at risk of these diseases. And tell them it in detail. Not to scare them because you learn to use layman terms and not to, use big things to scare people so you're going to die. Don't tell us things. So we learn that we, properly counsel so that persons are aware, but we don't scare them away from taking the things that they need to take.
All right, so, okay, well said. All right, could you discuss the role of pharmacists as a part of the healthcare team and how do you yourself fit in the future?
Well, pharmacists are very integral in the healthcare team. They are important in ensuring that we're the last line of defense. So when everyone else has gone through and the doctor's diagnosed, has given treatment and everything, it's now our job to ensure that the patient is getting the correct thing at the correct dose so that they're being treated properly. So we can't allow a patient to go home without us first checking if it is correct, because that would be on our shoulders. Something happens to that patient. So it's important for us to be clinical advisors to everyone else at the healthcare team. So if someone is on the healthcare team needs some advice on how to treat a certain disease or how to move forward with a certain situation happening with a patient, because patients are diverse, everybody is different. So it's not a textbook type of thing, especially in the setting.
Yeah.
So you must know how to navigate these things, and pharmacists are important in that aspect as well.
All right. As a student, at least at the hospital, you have realized that we have a severe staff shortage issue as well as with the work overload. Could you suggest to the government some of the solutions that you think we can possible solution to this problem, workload and
Well, what I can say is the biggest solution is just getting more pharmacists are getting more for any healthcare profession, it's just getting more people. But we know that can be difficult, especially the economy that we're in and our budget and all those things. But definitely if we can get more pharmacists, then it's easier to spread them across different areas in the hospital. And that might not be easy, but that's really the solution to get more pharmacists so we can place them in different fields. When that happens, it's easier for everyone else and then creating as well because pharmacists cannot extend themselves to really play the role that they're supposed to play in health.
Okay, all right, well said. All right, now, I used to be a medical student and I used to have friends at the pharmacy, maybe nursing and other science areas, even general natural sciences. And normally these degree programs are very hectic, right? In terms of the workload, the amount of work that you have to put in, coursework, frequent exams. All right, so now I want to ask you, how do you cope with like self-care in terms of how do you cope with managing this hectic schedule plus balancing social life?
Well, I'd say the first thing is prioritizing. So what is most important at that specific time? So it's not all the time that one thing will be most important. So you have to prioritize. So I like to write. I'm very structured in that way. So I write down exactly what I need to do for the day or what I have coming up for the week. And based on that, I can schedule out my time. But I always ensure that I make time for myself. So social time. So even if it's in the night, to go somewhere, to go and talk to friends, I always make that time. So that's very important in finding a balance. Actually be intentional about making time and putting things in the right place. But sometimes school will be the most important. But if you feel like you're crashing out, you cannot put school over your mental health. So at that point, you must take a little break. Not saying to throw everything aside, but you must take a little break at that point to say, all right, I'm going to take a break, relax, and come back again. So that's how I deal with managing the workload and ensure that I'm also involved in extracurricular things as well. So that my mind is not constantly always on pharmacy, but there are other things that I can also engage in.
Okay. All right. I can talk for myself. Like when I was young, I normally have like mentors or role models in the field, right? So like in the medical field, I would have my private doctor from when I was young, who would have seen me on lots of occasions, who would have been like my role model or my mentor. So in your case, is there any role model that you had or any mentor that had really inspired you throughout life?
Well, there are several persons in my life, not from the field, who would have influenced me and helped me to move forward, push me to move forward. However, currently I have a mentor that is in the field, and she does give me a lot of advice. So we talk about stuff in pharmacy. She is not retired, but she's very involved in pharmacy field still involved in NHF and all those things. And she definitely does motivate me. And when she has the chance, she reach out and send a motivational message, or she talk to me about pharmacy things, and she's always pushing me to go further. So she'll ask, what are you doing after school? When you leave UTech, what are you gonna do? Are you gonna go to America to study something else? Are you gonna go overseas to do this? Or what are you going to do? So she really does push me and motivate me to go forward. And she has me thinking all the time, what would I do next? Because I mean, it's not wrong to just be a pharmacist, but you want to do more.
Okay, all right. So what are some of your long-term career goals that you have?
And so currently I am really interested in oncology, and I am doing some research to see how much of a role a pharmacist can play in the field of oncology. So I've been looking overseas, to see there are the programs where you can, get more acquainted with treating oncology, treatment of patients in oncology. Because that's what I'm really interested in based on, some family stuff and so on. So my intention is when I leave, there's a program that exists such as that. I would actually want to go ahead and do that.
Okay. All right. And that's right. Like when I was growing up as a youngster, I normally was more familiar with doctors in healthcare. It's actually the benefits when my teenager adult, I found out that there were so many different different occupation in the same healthcare part of the team. So what would have led you to choose to become a pharmacist instead of a doctor, a nurse, or another healthcare?
So When I was younger, the thing is, I didn't go to doctor a lot because I was hardly really sick.
Okay.
So most times it would be like maybe I had to call or something like that. And mother would just say, go to the pharmacy and get this. So it was more so that I was interfacing with more pharmacists than I was interfacing with doctors because I wasn't really sickly. So the most it would be is a cough syrup or some stuff like that. So I really saw the pharmacists. I always wonder what they were doing around there. Because them in their white coat, they look interesting, but I don't know what they do. But it's growing up and reading more that I started to see what these people reading. Because I knew that if you go to them and ask them, you probably feel sick. They came and go like to say something. One, I thought, get to them and say, I'm feeling this way, tell them I see something. And they might try to tell them, but they still advise you to go to the doctor, to get the financing. However, I interviewed a lot of pharmacists, so that's why I became interested in that more so other careers because I was
in the field. Alright. No, I could not finish this interview without asking a particular question, which I think that where I high regards the pharmacists. We know that the prescription, they're not always typed up, right? They are handwritten, right? And doctors are known to have probably the poorest penmanship in the world, alright? So how how do pharmacists actually figure out the drugs that they're doing? What's the technique that they use?
Well, let me tell you. So the first thing is sometimes you really are just really looking really hard to see what's on the prescription. However, over time, because you have experience, you learn the different doses and how stuff are taken. For example, if it is scribble 75 milligrams once daily, you kind of know what that is. So because it's unique to that drug. But of course, we don't always just read and know. Sometimes you have to call the doctor to ask what it is that was written. So we never made assumptions.
Okay.
If we don't know, then we don't know. So we will call and find out. But really, there is no special language. The person that there's a special language that we are learning. There is no special language. You just actually have to try to read what is written there. There's regular medical terminologies that everyone uses in healthcare. Those are things that are also in the prescription that we'll have to know how to read those, but there's no obvious special language. So we just have to try to read it, and based on our knowledge and experience on the drugs and how they are taken, then we can also figure out what is there. But we always call to confirm.
Okay, alright, thank you. Alright, so any final word for like students who want to become a pharmacist and want to matriculate, any advice that you have can give them for it in the session?
Well, I would say don't be deterred by the whole science and all that. I used to think that I wasn't good in math, so maybe this is not for me, but I work on calculations. However, just have to practice. Once you're in pharmacy school, you realize you just have to practice and practice and practice. Practice makes perfect. Don't be deterred, just try your best. Do your best in your C6 and your CAPES because they want the good grades. That's what they're looking for. So you might not be at the top of the list if you don't do very well. So I'd say do well in school, focus, and when you reach to university, ensure that you keep that focus because it's not going to be easy. So that's what I'd have to say to incoming students.
Okay, Ms. Williams, well said, and I wish you all the best in the future, and hope you complete your studies successfully, which I know you will, and be the best pharmacist there is, right? So, viewers, remember to share, like, subscribe, and leave a comment on that video, and you can please share with persons that are interested in becoming a pharmacist, or students that are studying the science subject. Until next episode, stay tuned.
Be sure to subscribe for more informative contents on life, sickness, and death.